lot more informally than I would originally had planned, because I have a strong feeling I'm much more preaching to the choir here than might have otherwise occurred, and I'm guessing that you guys are probably fairly familiar as a group with the direction that we've taken healthcare in this country and the direction we may be going. So I'm going to start by just telling you a little bit about myself and why I find this such an interesting subject. I am currently a social worker at Metro Health Medical Center in Cleveland, in addition to my teaching duties here. And as probably you may or may not know, Metro Health is one of the few public hospitals left in the area. There's only two in the state, but nationwide, public health hospitals have closed right and left. And the idea of a public hospital is to be supposedly a catch-all for people that don't have insurance, but that's not really the reality of what happens. And we can talk a little bit more about that. But I find the policies behind it completely fascinating. And I find that when people start really looking at dollars, it's the two gentlemen that came in that didn't stay, I heard the one comment on that this is just going to raise our taxes. But I think what people miss in the big picture is we shift dollars. We don't necessarily undo the cost. For example, if you're insuring less people and they're going to a public hospital, and the public hospital is now supporting people that can't pay a bill, somebody pays for that. Whether it's on a county level, whether it's on a local level, whether the hospital has to eat part of the bill, or whether our taxes are going to it in another way, they're still going to pay for the uninsured in this country. And then we have all the other issues that go on top of it, is what happens when people don't get care and they present sicker. Would prevention be a better way to address the health issues? So I do find these things really fascinating. And before I go further, I was planning to talk a little bit about the history of Medicare and Medicaid and the concerns about the direction those are going. But I'm guessing you guys all everybody's pretty familiar with that. Probably. Yes. You can talk. We'll have a discussion pretty much. And why we miss so many people who are uninsured now in this country. Medicaid, just as an overview, is more a means test based on income. Medicare is paid into. It's not a free program. Stop me if this is all stuff you guys already know. You pay taxes into Medicare every way through if you're working. And then there's still co-pays, deductibles, a premium cost even when you turn 65 if you're eligible. So it's not free health care. And one of my big concerns with Medicare is that we are now in a society where the elderly is the fastest growing population, percentage-wise. There are estimated to be 80 million people by the middle of this century that are going to be 65 and over, whereas at the beginning of the century there were only 3 million in that category. And when Medicare was set up, it wasn't set up necessarily expecting that kind of population growth in that category, because people are living longer, we have medical technologies, but people in this category are still sick, and sicker generally than the average population. So Medicare is not going to be able to continue to fund those large numbers of people in that category when, even if they were paying taxes into the program, they were paying taxes in the 50s and 60s at a rate that's totally different than inflation warrants. So how is Medicare going to continue to fund that group? It can't. Medicaid, being income-based, the policies and the timing of that is something that's been happening lately. When you look at, for straight Medicaid to be 100% poverty, I pulled out the current figures, and for a household of two, 14,000 is considered poverty level. You make more than that, and you're not eligible as a family of two for straight Medicaid. And that's really, if you think about trying to live on 14,000 for a family of two, that's not a lot of money. The programs that we have for pregnant women and children are a little more generous than that. State by state, there's some variation, but in this state, you can make 200% poverty level and qualify as a pregnant woman or a child. But that's still only 21,000 changing the amount that employees have to pay as a copay for their insurance. I know of places now that will no longer insure a spouse who is eligible through insurance through another job, and that's unheard of in the past. We hear talk now from the Republican side that they would consider any employer-sponsored, the amount the employer pays toward your insurance on the job as something that could be conceivably taxable. It's considered part of your income. So if you think about what an employer is paying towards your health care, and that could be taxed as part of your income, I wish the gentleman had stayed who are worried about their taxes going up with universal health care, because there's so many other ways to look at how expensive things are going to be in a healthcare system. I'm going very fast because I'm assuming you guys are fairly familiar. Please stop me if you have questions if you want to discuss any particular points. I will also tell you that I am greatly concerned about this from a personal level, because I do have a child with a chronic illness. She is 16. I am greatly concerned about pre-existing conditions being a barrier for her to health care when she's an adult. She has Crohn's disease. I don't know how many of you are familiar with that, but right now, every 5 weeks, she gets an infusion of a medication called Remicade. If we were paying out of pocket, that would cost $7,000 per infusion. I have calculated that even if she is fortunate enough to get employer-sponsored health insurance as an adult, just her Remicade treatments alone, if she has a program where there's $1 million cap on the program, which many do, my own policy has $1 million cap on it, my child could reach the cap of $1 million by the time she's 36 years old. And that's just her Remicade treatments. That's not doctor's visits, that's not other medicine she's on, that's not hospitalizations that she might incur. That terrifies me. I'm very, very concerned about what's going to happen in her future, and there's millions of other people in that category too. And then what if she has a situation where she's ill and it's hard for her to work at a job where she's can keep a full-time job with benefits, with access to time off for her illness. And there's so many things that play into this. I'm famous for talking in my classes about being a systems person, a big picture, and I really truly believe that one of the reasons that things fail in the way, the approaches that we try to take in grassroots movements is we try to look at one
You want to ask questions now or do it too much?
If somebody has a question now, go ahead.
I think also to blame are the cost of pharmaceuticals, and there not really being any policy set in place to regulate costs. I know that's a problem in the developing world, and it's also a problem here. And part of that is our intellectual property system that grants new patents for old drugs. That's the issue I know right now in the India and Novartis case, which fortunately India won. But I think that is a huge issue. It needs to be revisited in the United States. And also, I think even bigger than this is our economy. We have a tertiary economy. We don't make anything anymore. And I think that our healthcare system funds our economy. If we look at it, when people are sick, companies make money from all parts and all sectors, and you can employ people with little to no education all the way up to the most educated people somewhere in the healthcare system. So it is, I think, relied on as a means of making money for this country. And I personally feel, and maybe 50 years from now we'll find out, that our government and our corporations are relying on people being sick to generate income for the country. That's my personal opinion. Whether or not it's true, I don't know. But that's my theory, and I'm going to prove it. But I wanted you to speak on that if you have similar thoughts or not.
Well, of course, the optimist in me would like to believe that that there is always going to be enough sickness to because the flip side of that is when people are out sick from work, individual employers lose dollars. With any time somebody's calling out sick or having a baby or otherwise missing work, the individual employer suffers. So there's a flip side of that. Maybe the healthcare system gains in a sense of they're getting dollars. And yes, a hospital gets more money for a hospitalization of a certain type versus another type. But they lose money on the other side.
I don't necessarily mean people being hospitalized. And someone with chronic illness who can go to work but is dependent on, for example, your dog. $7,000 for treatment, is that really necessary?
Right, is that what it costs?
It's highly inflated.
Sure.
She's not hospitalized, so she can, when she's an adult, work or whatever and participate regularly in society. But the cost of her treatment, that's what I'm talking about. Someone with diabetes who has to prick themselves several times a day, those test strips cost, I believe, like $80, $90 a box, which lasts maybe a couple of weeks. Right. So I mean that type, someone with a chronic illness like your daughter, or who can function and throughout their daily life as normal, but are dependent on medications in the healthcare system.
Right. No, I do agree with that. I don't, without really knowing what because an interesting example of this is we had a pharmaceutical rep come into the hospital to talk to us recently about a new medication for the resistant staph infection that you're hearing a lot about MRSA. And they are saying that their drug is better because this is the only one that hasn't shown a resistance yet. And this is the best course of action. It doesn't have to be done intravenously, which once you're admitted as an inpatient, the standard of care right now is an IV drug. And but this particular medication is extremely expensive. And the reason he came to talk to the social work department was he wanted to talk about the program for the indigent to get help paying for this medication because it's not a medication that somebody would be able to pay for out of pocket. And when he was done with his entire presentation, I asked him, why does the medication cost that much? And his answer was, the first which was, so much research goes into this one medication, you have no idea how many dollars went in to come up with this one. And when all was said and done, he actually said, and we purposely want to keep the cost high because we don't want this particular medication misprescribed. as in, if doctors start prescribing this for any old infection, it's going to develop a resistance for this one. So we purposely want to keep it somewhat inflated to prevent people from just prescribing it for any type of infection. So yes, it's out there. No question that there are situations where the costs don't reflect what is going into making the medication, and there's many reasons for that. Certainly profit for those companies is one of them. And the majority of our healthcare system is for profit. There are very, very few public institutions left which are not for profit. And whenever anything is for profit, you have to worry about how much inflation is there in any given year. It certainly is there, no question. Whether that means people are are not given full treatment, I'd like to believe that that's not the case. But we can get into a whole other discussion because everything again for me is connected. And you could get into why are we not funding stem cell research in this country in a different way when that could cure conditions now that we can't cure. So there's certainly that suspicion whenever anything is set up as a for-profit system. Does that address the whole issue?
I think I'd like to comment a little bit more on that too. With the pharmaceuticals, they make over 13% profit on typical drug companies making an average of 13% profit, which is a lot more than the Fortune 500 companies. Drug companies spend over 50% of their income on profit and advertising. There are I've heard numbers as low as 5 drug reps for every doctor, and as high as, I'm sorry, there's 1 drug rep for every 5 doctors, or as few as 1 drug rep for every 7 doctors. You can't turn on a TV anymore without seeing a commercial that's got somebody leaning up against the wall, or dancing through a field or something. And half the time you finish the commercial and you're not really sure what it was going to fix, but you knew it was going to make you feel better, so you want to go out and get it. That's where the money's going. Less than a third of their gross income is spent on research and development. It's a tired and old argument that drug companies use, and it's not true. It's simply not true. And they can, just keep charging because there is no centralized system to control the costs. Canada has, if you buy drugs in Canada, the government buys the drugs through a central system. So there's not all these different people bidding for the drugs. The government says this is how much we're going to pay for this many. Take it or don't. And of course, the companies tell us well because they're still making a profit.
And his answer was.
Is anyone familiar with any efforts to stop advertising to the public for prescriptions? Is there any push anywhere for that?
I have heard of some, but I'm not really familiar with that. I know there's some things in Congress actually.
There are.
It's been brought up.
The only things I know of are that they had to include the side effects. Now you see those commercials, but then also there's supposedly more limits on the perks that they can offer physicians when they go to talk to the used to come and pick up trips to the Bahamas. And there are caps supposedly now that they can offer physicians with those market their particular medication.
There has been some stuff, hasn't there, on misleading advertising. Famous or infamous doctor wasn't, gave the incorrect impression that he had expertise in talking about what was the drug Littleton. After congressional investigation, prior to it, they made the commercials.
It's also a very public farm free
don't know how much they cost. If I'm getting sick and I'm in the emergency room and I feel really bad and you say, go take this, I'm going to the drugstore to get it. If I feel terrible. Now when I get there, then I have the shock that the medicine costs $10 a piece. And I don't have the money to give me $5 so I can get through the night and I'll feel better. And once I feel better, then I won't take it anymore. Or I will save it because it's so expensive so that when I feel bad again, then I'll have some. But in the private doctor's offices, they have office managers. And so we're in such a, medicine is money. The doctors all have office managers. That's what the office managers do. Keep the money in, keep it streamlined. Unless they want to hire a nurse practitioner to give this extra teaching to do that. I don't think they're really concerned with that. Because most of them are in associations now. And if you go and you're in association, because I'm at one in Akron General, it's about a 15 to 20 minute limit. Otherwise, you're not productive to the group practice if you take too long. And so it's got to keep on moving. So then they have all these other people who, if you want to have a prescription refill, you just call and go through the voicemail. It's not till you get to the Walgreens. Now, you know to ask ahead of time, and they will tell you that. Some people don't have all that mechanism to do that.
Which also brings up the point of when you don't have health insurance, people who don't have health insurance are much more likely to use an emergency room rather than going to a less expensive appointment in it. Because maybe you can't get an appointment, maybe you're not used to going through that process. So, this week we've heard on the news people are going to the emergency room for everything. And things and use an ambulance sometimes, which again just increases costs because they can't necessarily pay for these things and they have a much bigger bill than they would have had if they were able to go to a doctor as an outpatient and utilize the services in a way that the average person utilizes them.
But a lot of doctors won't see you.
Right.
Because they have a limit on how many Medicaid patients they're going to take. When you go in these doctors' offices, the sign is there, prepare to pay unless you've made previous arrangements. And then if you call them, they say, I'm not taking any more Medicaid, then what are you going to do?
Or if you have no insurance, then they won't take you as a medication unless you pay for the total cost.
Self-pay. It's very, very different.
Once you're established. That first visit, you're going to pay the whole thing out.
That's about $250 to see anybody the first time. You might not see them about 20 minutes, but it's about $250 first time cost.
If you're considering a category, which is a category that's mostly uninsured, that's a lot of money to shell out. Somebody probably wants no groceries. It's a different situation.
It kind of transitions as we can identify what the issues are. So that's one of the possible solutions.
There's a possible solution. There's the solution. Like Amanda said, I'm a member of SPAN Ohio. It's a single payer action network Ohio. It's a nonpartisan grassroots organization devoted to the fundamental change of healthcare. The reason we're doing it on a state level, it's needed nationally, but the reason we're doing it on a state level is because in Ohio, the citizens can write a law and enact it. On the federal level, we have to wait for the politicians, our elected representatives, to get the law passed. House Bill 676, written by Conyers and Kucinich years ago, has been sitting and waiting for the politicians in Washington to pass it, and they haven't done it. If you look on their website, you go to opensecrets.org, you'll see where they get their money from. They get their money from insurance companies and pharmaceuticals. They're not going to kill the golden calf, They're just going to keep on taking the money and look out for their interests. But on the state level, we can write our law. And we have written a law. It's called the Healthcare for All Ohioans Act. It's been introduced in the legislature by friendly politicians, Mike Skindell and some others in the House, and most recently by Dale Miller in the Senate. But again, it's not passing in either house. It's not even getting a fair hearing because there's too much money against it. So we also have an initiative petition going. And the way the law is in Ohio, citizens can either write a constitutional amendment, which requires about 300,000 signatures, and then it goes on the ballot at the next general election for the people to vote on, or an initiative petition, which is what we have. And we need 10% of the people who voted in the last gubernatorial election, about 120,000 signatures to get it in front of the legislature. The legislature then has 4 months to either pass it, amend it with our approval, or reject it. In the event that they reject it, we have 90 days to go out and get an additional 120,000 signatures, and then they have to put it on the ballot in the next general election. So we're doing this from two different angles. We've got it already introduced in the House and the Senate, but we're also working on the initiative petition. We're close to 100,000 signatures already. Of course, we want to have a push. You go in with 120,000. They find one wrong and you're not there. So we'd like to go in with 200,000 if possible. And that's why we're doing it at a state level. Now, what SPAN is, the Healthcare for All Ohioans Act is, essentially everybody in the state of Ohio is covered from conception till the time they're put in the ground. No questions, no ifs, ands, or buts, you're covered. What I'd like to do is just read a short excerpt from the summary of the bill. It says the proposed law establishes the Healthcare for All Ohio, establishes the Ohio Healthcare Plan, which will provide all qualifying Ohio residents and all qualifying persons employed in Ohio with coverage for inpatient and outpatient hospital care, preventative care, mental health, vision, hearing, prescription drugs, dental, emergency services, rehabilitation services, hospice care, home care, health maintenance care, medical supplies, necessary transportation for covered health care services, and all other necessary medical services as determined by any state licensed, certified, accredited, or otherwise authorized provider. So essentially what this does is it gets rid of the insurance companies. Now the state becomes a single payer insurer for all their citizens. Now, we were listening before, we know that insurance companies are a big part of the problem. Almost 30 cents from every healthcare dollar that we pay goes to their administrative costs and profits. When we wipe that out, we have a lot more money to deal with healthcare. The General Accounting Office and the Congressional Budget Office have both looked at national single-payer plans, and they've come to the conclusion that what is currently being spent on healthcare in the United States, which is $2 trillion now, we could cover everyone, fully cover everyone in the United States and have money left over. All we have to do is get rid of the insurance companies. Again, we can't do that on a national level on our own, but on a grassroots level, we can make it happen in Ohio. And that's what SPAN Ohio is doing. We've got this petition drive going, and we need to collect signatures. Personally, I've been involved. 2 years ago, I walked around Ohio, took 3 weeks vacation, walked 600 miles, talked to people, did interviews, did all kinds of interactions, and got some publicity. I plan to do it again this year. It'll be another 600-mile walk. I'll be leaving Cleveland, going east to about the Pennsylvania border, then south down through Appalachia, and back up to Cleveland. It's about 20 to 30 miles a day. When I got involved with this to begin with, though, it was like the professor said before, my thought was that if you need healthcare, get off your lazy butt and go get a job. I didn't realize the depth of this and width of this problem. It's amazing how many people are uninsured and underinsured. That's the biggest problem, is the underinsured. You know, if we look at the Massachusetts plan, which is one of the state solutions, what they've done is they've instituted mandates in Massachusetts. So people who before didn't have to pay for health insurance now have to pay for health insurance. They have to pay a premium cost or share in the premium cost for a high deductible health care plan. Now that's more money coming out of their pocket. The problem is, with this additional money coming out of their pocket, when they go to use their high deductible plan, they don't have the money for the deductible. So they can't use the insurance. They're not getting health care. All they're getting is health insurance. We don't need that solution. What we need is health care. It's real simple. We face a lot of challenges getting this done. Obviously, the insurance companies are going to lose money. In Ohio alone, we spend $72 billion a year on health care. $72 billion. Half of that's already being paid by the federal government. Medicare, Medicaid, veterans, government employees. So all we had to raise for Span Ohio for the Health Care for All Ohioans Act is $36 billion. You know, it's getting easier and easier to say $36 billion. It's great. And these purple sheets were on the table when you came in. Make sure you pick them up when you go up. On the back of it, where it has funding for the Health Care for All Ohioans Act. Because that's something that everybody asks, okay? The first thing we're going to do is we're going to wipe out all insurance premiums. Nobody's going to pay for insurance anymore in the state of Ohio. So like right now, GM, Rick Wagoner says, for every car that comes off the line, GM pays $1,600 for health care for their current and their retired employees. Thanks, Rick. In Canada, the same cars coming off the line cost $600 because they have a national insurance program. So what this will do is, in Ohio now, GM will no longer have to pay for health insurance. Walmart, and with a little bit that they pay, Pizza Hut, McDonald's, the neighborhood dry cleaner, all these folks that don't currently pay for health insurance are going to have to start contributing some. At the bottom it shows that there will be up to a 3.85% payroll tax paid by all employers. So it's leveling the playing field. It's no longer going to be the Giant Eagles of the world or the Costco's facing a fight against Walmart. Because Giant Eagle pays for health insurance for their employees. Heinz pays for health insurance for their employees. Walmart, until very recently, didn't, and what they're paying now, they might as well not even bother. So all of a sudden now they're going to be paying the same amount as Giant Eagle. There would also be up to a 3% gross receipts tax paid by all businesses. Now, one of the savings on this is going to be with governments, because currently governments, a big part of their expense is health care for their employees. Up to anywhere from 10 to about 18% of personnel budget for government office is health care. So their payroll would go from a 10 to 18% health care to a 3%. The governments don't have gross receipts, so the government isn't going to have to pay that. So the city of Akron now is going to save a whole bunch of money. They'll be able to fix some of the roads. I don't know if anybody knows they're coming in today. I sure did. The police, the fire, the emergency and medical services, they'll have all kinds of money for this because they're not going to be putting it into health care for their employees. And their employees are going to have health care. It's at least as good as what the elected officials get, if not better than what they currently get right now. Because understand, under the Health Care for All Ohioans Act, there are no co-pays, there are no deductibles, we don't care about pre-existing conditions, all it is health care. Just everybody's in, nobody's out. Personal responsibility on this, I'll go through the text and I'll get back to it in a second. The next line is 6.2% on individual compensation in excess of the Social Security cap. This year, looking at the sheet, the cap for Social Security is $102,000. So you pay Social Security tax on 100% of your income up to $102,000. After that, you stop paying Social Security tax. So most of us pay Social Security tax on 100% of our income. People who make $200,000, $300,000, $400,000 a year only pay Social Security tax on a fraction of their income. Again, what this will do is, when they stop paying the Social Security tax, that money will keep paying the tax, but instead of going to Social Security, now it'll go to the Healthcare for All Ohioans Act. And anybody who makes over $200,000 a year will pay 5% on adjusted gross incomes over $200,000. The last line, the funds from other government sources, what we hope to do, and of course we can't do it until it's enacted, is, remember I said we're already paying, the federal government's already paying $36 billion a year for healthcare in Ohio. What we'd like to be able to do once this law passes is go to the federal government and say, look, give us the $36 billion and go away. Just give us the money and leave. So that instead of somebody going with Medicare, going up in Medicare being the first payer, and then Healthcare for All Ohioans Act picking up the difference, we just simplify everything. Just one card pays it all. Failing that though, the way it would happen would be Medicare would cover their part, and then Healthcare for All Ohioans Act would pay the rest. So obviously now, Medicare D, somebody would be foolish to buy Medicare D because it's already going to be covered under this. You had a question or comment? I can go on forever, but
I had a few questions. One, you mentioned prevention, and I think that is pretty much should be our first line in terms of healthcare. But it oftentimes now health plans don't really provide any coverage for prevention. What do you know right now? Like, what would be recommended to this healthcare plan for people who get all their regular checkups, who work out regularly at a health club, or any of the other things that are preventive? What would be recommended to assure that people have money to do that? That's my first question.
yeah. Well, the thing is the law's not going to mandate that anybody participate in any insurance, gym membership or anything like that. The law's already been written. It's 36 pages long, and you can see it online at the website if you want to read the whole bill. The whole language is there. But what the bill does is when you go to the doctor, it's paid for. It's covered. It's not a matter of I don't have the money to see the doctor. And that's one of my problems right now. If you think back in the 70s and 80s, the HMOs were going to save us. Health insurance costs are going through the roof, and the HMOs are going to save us. And that didn't quite work out. So then the PPOs in the 90s were going to save us. That's, people don't like HMOs. They don't like the restrictions. So we're going to do the PPOs and give people a little bit more flexibility, but we're still going to be able to control costs. And that didn't work out so well. And now we've moved to the health savings accounts. That's what's really going to control the money, because now people are going to be invested in it. And what happens is people don't spend that money. Okay, when people have a headache for a day or a couple of days or a couple of weeks, they wait for it to go away rather than spending the money from their health savings account, which means that possibly that tumor that's giving them the headache is continuing to grow and going undiagnosed. And when they finally can't stand the pain anymore, then they go in and get it checked out, and then it's too late. So what this does is it's not going to cost anything to go to the doctor and get it checked out. You may go to a nurse practitioner and get it checked out. You can work through your doctor's office in a bunch of different ways. The problem right now in this country is when kids, I shouldn't even really call them kids, when doctors graduate from medical school, they graduate $125,000 to $200,000 in debt. And they have a choice to make at that time, whether they follow their heart and become a primary care physician, or if they go into a specialty where they can make more money. I'd like to find out where these offices are where they limit you to 15 or 20 minutes, because most doctors in the Cleveland area are trying to get you out after 5 or 10 minutes. And it's for the same reason, because they've got to, they got to push it through and make the money. And under this, it's going to control the costs for the doctors, and it's going to keep enable people to get in for that preventative care.
Is there a cap on how many preventative visits or anything like that?
No, there's not.
There doesn't need, you have a relationship with your doctor, with the doctor of your choice, and you can go to them and say, like it was 30 or 40 years ago, I have a family history of heart disease, and your doctor has the time and the ability to spend with you to say, we're going to look at your family history, do the appropriate testing, and we're going to set up a plan for your future. Those days are gone.
To get the pre-diabetic person before they actually develop the diabetes. And that's what I meant by prevention. Maybe health education classes, and not saying that going to the gym is mandatory, but if you do go, that too could be covered, or you can get a discount on it.
There's nothing in the bill for that,
Okay.
for that type of thing. But again, with the prevention, like right now, my mom is 76, 77, I think. She's got osteoporosis. She's probably shrunk about 3 to 4 inches in the last year and a half. My sister, who's 56, her doctor wants her to get some additional tests beyond just the bone density. There's some further tests in. Her insurance doesn't want to cover it. Now, that would be covered under this because, like I said, it's preventative medicine. But her insurance, her and her employer were paying probably $10,000 or $11,000 a year for, isn't getting her covered. So that's the big thing, is the preventative care. That's going to control a lot of the costs. Like the professor was saying before, people come into, and I'm from Cleveland, Metro Hospital. They get rated. They go in there for their care. And what happens is that a lot of the cost gets rolled into the general overhead. Families USA last year did a study that said that $900 of every family insurance policy goes to cover the uncompensated care of doctors and hospitals. It's just rolled over into the other costs. Did you have another question? Okay.
And you can kind of roll this in one. I wanted to know what happens to the insurance companies and their employees if this is enacted. What if this, catches like wildfire and all of the states adopt this? So then what happens to all of the insurance companies, their employees, and the economy? Because I do think that our economy is kind of dependent somewhat on our current healthcare structure. And then I wanted to know what any opponents to stand, what are the criticisms of this plan.
Well, first of all, if you look at the Canadian healthcare system, it started in the Saskatchewan province. And actually, this Canadian system has 5 different healthcare systems that are covered by one set of principles, but they all have to meet, but each province has its own healthcare system. And that's exactly what happened in Canada. They did it in the Saskatchewan province, and it spread to the other ones. In this country, it's the same thing with any other social movement. The women's suffrage movement, that happened in Wyoming. And it happened in Wyoming because Wyoming didn't have enough citizens to become a state. Well, they figured out in Wyoming, if they gave women the right to vote, they would become citizens, and then they'd have enough citizens to become a member of the United States. So they did, and as a matter of fact, they had more votes than any of the other states because they had so many citizens. And then the other states went ahead and did the same thing. It wasn't quite as simple as that, but that's the short version. To your other question, if you look on the front of the purple sheet, the highlights, number 9, people who lose jobs as a result of this passing in Ohio will be eligible for up to $60,000 a year for 2 years. What we'd like to do, every doctor's office has at least one person who does nothing but billing. That's their job, to sift through all the different insurance paperwork and the doctor paperwork, and come up with the right combination to send the bills. I've got Blue Cross right now, and that's my wife's job. She handles the insurance. But I go to the doctor, he sends a bill, it says, do not pay, because we're submitting it to your insurance company. Then I get something from the insurance company saying, your doctor has submitted this bill. Do not pay this is not a bill. Then I get something from my doctor that says, your insurance company has paid this much, and we are resubmitting it for further payment. And I get something else from the insurance company that says, we are doing further processing. There's 10 or 15 sheets of paper before the bill's paid. So this is all going to be eliminated, and you're right, there's going to be a lot of jobs that are eliminated. And what we want to do is get those people out of the health insurance business and into the healthcare business. So, so there aren't going to be, we'd like to see more nurse practitioners, more PAs, more MAs, more people working in the facilities. And this will facilitate that by because it's going to give them up to $60,000 for up to 2 years. So that's 2 years of community college education, a 2-year degree. They could be X-ray techs, they could be LPNs, all kinds of things they can get in 2 years. And with $60,000, that gives them plenty of time to get it done.
You make an assumption
But they'll do it.
and that they want to do that. People, they're doing that because they like that. They don't want direct care. A lot of people they don't want to touch the person now. They don't want to do direct care. $60,000 sounds good at the moment. And some people may use that to pay up their bills, car note, and everything else. I don't know that is a good gesture, but I don't know if that's going to solve the problem to say you go into health care or some other avenue. Because they like the paper. And I agree with you about all the paperwork that goes, but they waste so much postage and paper and people that handle that. That I don't think that's a good idea.
Well, the thing is, I'm with the UAW, okay? And when I got involved with this, that was one of my concerns. It was like, there's a lot of people out here, I've got no problem, with the guy, I forget his name now, from United Health last year, that left with $13 billion, golden parachute. McGuire, yeah. I've got no problem with him losing his job, yes. But there's a lot of folks out there that help us every day under the current system. I didn't want to be a part of them losing their job. And I have seen a lot of people lose jobs, here in Akron with rubber and steel, in Cleveland area with steel, and with the automotive industry. And when these folks leave, when these jobs leave, these folks get 6 months of unemployment, and that's it. Maybe if they're lucky, they get some TAA benefits. And with this, if Ohio can be first, okay, I look at this also as an economic development tool. It's going to create jobs. Last year in Lorain County, Ohio, they closed the Lorain Assembly Plant. Okay, in the Lorain Assembly Plant, their main product was the Ford Escape. Now, Kansas City Assembly makes the same product. Okay, if this law would have been in effect at that time, Ford would have had a decision to make. Do we close the Lorain Assembly Plant, where we have controlled health care costs, or do we close the Kansas City Assembly Plant, where we've got uncontrolled health care costs? To me, it's a no-brainer. They close Kansas City and bring those jobs to Ohio. How many people do we have that are tied in their jobs because they can't leave because of the health insurance? How many places, if your daughter ever gets health insurance from a company, she's gonna have to stay there regardless. She hates the job because she's not gonna be able to get health insurance. She could have the best idea in the world, but she's not gonna be able to implement it because she won't be able to go out and buy health insurance on her own. My brother-in-law had a small electronics company. Did everything right. Did everything he was supposed to do in life. He graduated from high school. He didn't graduate from high school. Dropped out of high school. Got his GED when he was in the Army. Got out of the Army. started his own business, built the business up. He was ready to retire at age 55. Had enough money to retire, but he made a mistake. He got prostate cancer at 46. Got it cured, got it caught in time. Everything was great. But now when he wants to retire and go outside of his company and buy insurance, he can't get insurance anymore. He had to stay employed till he was 65 and eligible for Medicare so that he could have insurance. It's insane. He couldn't buy insurance for any price. It just won't sell.
Another element to your question that comes to my mind is has to do with the nature of the distribution of money that goes into the healthcare system, which is a more healthcare industry, which looks at healthcare as a commodity. And if you look at the dollar, $1 that's going in, and 30 cents of that dollar is being extracted by the insurance industry. Some of that, yes, is paid for people to manage the paperwork, and it's hiring people, but some of that is going for the very few at the top. Well, now, if that crowd is gone, and the CEOs and chief financial officers, I'm not going to shed maybe a few crocodile tears, but that's about it. But once those dollars are freed up, all right, yeah, there's going to be some that are working the blue-collar jobs that are going to have to figure out how to be redirected. But you have all those saved dollars now. And now, if automobiles are cheaper, right, you're not paying to get a car, the healthcare costs, or if every product that we purchase now is cheaper in cents because we're not covering the healthcare dollar, that means we have more dollars left over to spend in other things. That creates a super duper stimulus package that when you're starting to spend dollars in the system for everything else in the economy, well, that is going to create jobs somewhere else. So that will absorb easily, I would think, the jobs that are being lost in other areas.
Oh yeah, again, I'm a union guy. I'm all for work, but making work to push papers around. Again, that's what, like when we get into the health savings accounts. It's just another level of bureaucracy that the insurance companies are adding, because now somebody's got to track the money that I spend. They've got to track my savings account. They have to know when to kick in the high deductible plan that goes with it. It just keeps on building and building. And of course, the CEOs, the CFOs that Greg was talking about, all those folks work off a percentage of the income. So it's great. The costs just keep on going up, and the insurance company just keeps shuffling the money. The problem with right now the leading presidential candidates with their healthcare plans is they all keep the insurance companies in. And that's for any of their plans are doomed to failure. They throw stones at each other. I throw stones at all of them because none of them are going to work. The only thing that's been proven to work is a single payer system. They talk about universal coverage. How do you get universal coverage? If I have to buy an insurance plan and the government makes me buy it by either fining me or taking my tax incentives or whatever, and I have to pay into that, and then when I go to use it, I have to pay again, I may not have health coverage. I may have part of universal insurance, but I don't have universal coverage. Universal coverage only comes when I can go in whatever I need to for whatever I need to go in for, if it is covered. That's why I'm involved in it. Just a
He didn't ask
quick
for a
story.
copay?
He didn't ask for a copay. Didn't, if you're looking at it, he did the Roman centurion, the rich man. He took care of his son just as quick as he did the Samaritan, who was a Samaritan leper, who obviously was despised by the Jews. He took care of the poor. He took care of women. It didn't matter. Race, creed, money. It didn't matter at all. And that's where I think we need to be. Real quick story from my walk last year. When I got to Columbus, it was set up so that, and I'm doing the same thing again this year, I'm leaving with my backpack, and every night somebody's supposed to take me in. Hopefully they'll set up some sort of public meeting so we can get the word out. They'll take me home, clean me up, feed me, and throw me out in the morning. And when I left last year, I had 7 places that I was scheduled to stay at on a 22-day walk. It worked out that I had a place to stay every night. There was some sort of media coverage almost every day. One of my favorites was when I got to Columbus. Dr. Farina said, I spent the night at her house. And she said, tomorrow morning, she said, I've got an interview set up for you. I said, oh, great. She said, it's going to be live TV. And I said, perfect. She said, it's going to be at 6 o'clock in the morning. Well, who's watching TV at 6 o'clock on a Saturday morning? I said, but, we'll do it, whatever it is, I agree to participate fully in whatever anybody has planned. So, first of all, last year in July of 06, if you recall, it was very, very wet month. It rained almost every day, except where Dave was. Dave got 4 hours of rain the entire month that I was out. Now, the day of the interview, it was a man on the corner, man on the street interview. Pouring down rain. Thunderstorm, lightning flashing in the background, made for TV. I got rain pouring off the ground I had. Mark and Mindy are in the studio. They asked me some questions. We talked about the act, talked about why I was doing it, et cetera, et cetera. And, we finished it up. It was probably about 10 minutes. Half an hour down the road, sun came out, dried out. It was beautiful the rest of the day. The next day was Sunday, and it was about 9:30. I'm walking past this real picturesque Methodist church, it's a white siding and the big, tall, skinny steeple. I saw church started at 9:45. Well, this week I'm a Methodist, so I walk in the door, and usually you go in the back of the church. The door I walked in brought me in right next to the lectern. So this lady looks at me. Were you on TV yesterday? I said, yes, ma'am. We talked for a little bit. I found out, first of all, that segment was so good because of the way it worked out that they showed it 4 more times throughout the day on every news show in the Columbus area on that channel. I talked to some other people before, when service was getting ready to start. This one woman comes up to me and identified herself as a deaconess. And she said, our pastor went into the hospital on Thursday to have his gallbladder removed, but they couldn't do it because he had, what's it called? Pacemaker? Well, water remover. Yeah. Like she said, pericarditis. So they couldn't do the surgery and wanted to know if I could come up and speak a little bit about, the act and why I do it, why I'm involved in this. So I got to deliver a 20-minute sermon on the Healthcare for All Ohioans Act. So, to me, it's the right thing to do. It's the right time to do it. People need it. Ohioans are dying every day. We lose 18,000 people in this country every year because of lack of health care. 18,000. That's 3 times as many people as would die in the Twin Towers. And yet this administration refuses to invade the insurance companies like he invaded a sovereign nation. This is a time. This is something that has got to happen. We've got to take care of people in this country. We've got to take care of people in this state. If Ohio does this, and Ohio will eventually do this, if we can be first on this, we can lead the nation. And we can get a lot of business into Ohio. We can create a lot of jobs in Ohio.
What about her question about opposition?
Opposition, yes. Yes, there is some. Again, we're talking about insurance companies. Like I said, there's a $72 billion economy in Ohio for healthcare, half of which is paid privately, which is insurance companies. And think about this now, insurance companies are getting 20 to 30 cents on every healthcare dollar. So 30 cents of every dollar of $36 billion is like $10 billion. You know, so they stand to lose a lot. The pharmaceuticals stand to lose a lot because we're, you know, again, the Healthcare for All Ohioans Act is going to cover prescription drugs for people. So yeah, there's going to be some serious money up against us, but we've got the one thing that they don't have, and that's we've got people, and it's, you know, we've got, in Ohio we have 1.5 million uninsured people, and we have at least that many underinsured people. All we have to do is get the word out to them, and it's slowly but surely getting out there. You know, and we need help from everybody. You know, students have always been, at colleges and universities, have always been the source for change in this country. You know, in the 60s with Vietnam, you know, colleges and universities have always been the source of free-thinking individuals, people who are willing to get out there and do things. Each petition book holds 65 signatures. You know, if every student on this campus went out and filled up a book, we'd be done tomorrow. And it's easy. You know, personally, I've collected over 4,000 signatures. And I would say that, you know, of course you get some people who don't even let you say why you're there. But anybody that I've been able to talk to, I would say over 90% of them signed it. And a lot of them want to sign for their wives or husbands or whatever. I have to explain to them that they can't do that. But it's something that everybody wants. It's something that everybody needs. And the problem is going to be with the money, they're going to put on the action, just like they did with the Harry and Louise ads with Clinton. And she was keeping the insurance companies in. And they were paying money to shut her up. Well, the small ones put up the money for that. Because her plan was going to get rid of all the small insurance companies and keep just a few big ones and let them have all the money. And the little insurance companies got together and paid for those ads as well as a lot of the other anti-national health insurance information. So
The big thing here is this is socialized medicine. And no, this is not socialized. The socialized programs include provincial, you know, government has control. The doctors are government employees. These are private doctors, private patients, private and public hospitals. This is not socialized.
That it really goes through what those big arguments are, just in talking to people, what they say about it.
all the right, the reality versus myth.
Yes.
You know, if you think about it, right now, if you walk out here and step in front of a bus, the city of Akron is going to send an ambulance, pick you up, give you all the medical care they can, and get you to the nearest hospital, where the first question is going to be, who are you and what's your insurance? You know, what's the difference? You know, there's some things that we do together socially that we do better individually. The police department. Do you want private police? Let's get rid of the socialized police department and have private police. We used to have private fire departments in this country until the 1800s. You want insurance. And when you bought the insurance, you got a plaque that you put on your house. And if your house caught on fire, the fire department came. If you had the plaque, they put the fire out. If you didn't have the plaque, and your neighbor did, they made sure your neighbor's house didn't catch on fire while yours burned down because you didn't have insurance. That's a lot like our insurance system works today in healthcare. You know, they take care of me because I've got good insurance. You know, if you're sick and you don't have good insurance, they're going to watch you until you're too sick, and then you can possibly get on Medicaid and get some treatment, some end-of-life palliative care, whatever. But they're not going to get in there early and take care of you. It's insane. It makes absolutely no sense.
What's the relationship between the presence of, or the lack, I guess, of the presence of public hospitals and this plan. Because one might believe, well, if there is a public hospital in my community, I don't need private insurance quite as much, so therefore this argument of getting rid of private insurance is less important because I can always go to the Metro.
Well, here's the thing, here's one of my things, and you can clean this up a little bit when I get done. But essentially, if I'm epileptic or diabetic, and I wake up today and I don't have any money, I don't have any insurance, I don't have my test strips, I don't have any insulin, or if I'm epileptic, I don't have any, I don't have my medication. And I go, I walk into the emergency room and say, hey, I'm Dave, and I'm an epileptic and I need some Dilantin. And they say, well, you're experiencing horror right now. Is there anything wrong right now? I said, well, no, but later on today, if I don't get my Dilantin, I'm going to have a problem. Basically, the emergency room's going to say, well, come on back when you got the problem. So I'll walk down the street, and I'll sit on the curb, whatever, till I, either go into a diabetic coma if I'm diabetic, or if I'm epileptic, when I get go into a seizure, somebody will call an ambulance. They'll take me to the hospital. They'll give me what I need, and they'll give me a prescription that I had this morning anyway, and I couldn't afford to fill, and send me on my way. It's insane. There's absolutely no sense of it. Now, obviously, the hospital can't afford to, everybody that walks in, just, give them a handful of Dilantin or give them, test strips and insulin or whatever they say they need, because that's the way our system is currently set up. And that's one of the things that this will correct. It'll also correct the day-to-day doctor visits, the fact that essentially hospitals will be working on a budget under this system. They'll submit a budget. All a budget is a plan. This is how much money we're going to spend. Again, I'm not from the Akron area, but I know that if I drive from my house in Cleveland out to Lorain County, as I'm driving up 90, I probably pass 10 or 12 billboards talking about the newest, the biggest, the bestest CRT and MRI machines available. Because they're advertising, because they don't have enough business for these machines. Because what they're doing is they're putting a place in to make money. And it's okay if they put this place out of business, because theirs is a little bit bigger, a little bit more, whatever. It doesn't matter about the capacity. They'll let the market get rid of the smaller places when it doesn't really need to be gotten rid of. So that, it's going to, before they can do that, there used to be a certificate of need before you can build a facility in Ohio. And that's gone. If you've got the money and the capital, you can invest. You can do just like the Cleveland Clinic, or just like University Hospital, and keep buying up all the hospitals, all the different facilities, and putting the other ones out of business. So that you get to a point where last summer, a child was shot within 20 blocks, I would say, of the Cleveland Clinic. And that child was life-flighted to Metro. It makes no sense. Obviously, Metro has the level 1 trauma center, but why wouldn't a world-class facility, Cleveland Clinic, University Hospital, right there in the neighborhood, why wouldn't that child go there? Doesn't make any sense.
I can tell you millions of stories, and the belief and the perceptions have nothing to do with reality. Every hospital in this nation is entitled to a program called HCAM, which is an emergency hospital payment, but you have to be, we're talking those poverty levels again to qualify for it. Most hospitals that are private hospitals don't advertise that they have it, that you can use it because they don't want to deal with that population. It's still not the same reimbursement that they're going to get from a private company. Occasionally you will see signs posted at any hospital, if you're unable to pay a bill, please let us know. But they don't go out and publicize that they're eligible for the same program, but you have to fee scale if they're not county residents. If they don't meet the Healthy Start guidelines, if they don't meet other things going on, they're not eligible for that anyway. But people are of the perception in the community, they'll go to Metro and they'll be paid for it, it's free, and that is not the reality. They're still gonna get a bill, they may not pay the bill, and then if they don't pay the bill, what happened to the dollars? You have hospitals going under because they can't afford it, that's why a lot of public hospitals have gone under. Or it's passed on to the other healthcare ways that we've discussed. It's not, that's one of the fallacies when people talk to me, when people talk about their taxes going up, they forget that they pay for it in another way now anyway. It's in your county dollars, it may be in your state tax dollars, it may be in your hospital bill, it may be in your insurance cost. It's also to me a fallacy when people talk about their tax rates going up when I have a friend right now who's trying to retire earlier than 65 when she might be eligible for Medicare. She went to her retirement board, she looked into it, she's found out to retire at the age she wants to retire and keep coverage for herself and her husband, she's going to be spending between $250 and $300 a month to keep the coverage, which doesn't sound like a lot, but when you add that up times 12 months and take the percentage of her income, even if there were a 10% tax on her income, she's going to spend more than that anyway in the out-of-pocket expenses to keep that insurance. So people forget that it sounds like, well, I don't want my taxes to go up, but they forget that average citizens who have had health insurance their whole lives are still paying an out-of-pocket fee. They're paying for part of their own insurance, they're paying deductibles, they're paying co-pays, they're paying prescription costs, and if you add up the dollars spent in a year, even if you were taxed 10% of your income instead, I bet you if you look at the scale for many people, it would still be less expensive to pay that, even if that were the way it was being funded. Does that answer that question?
Yeah, if you can't pay it, sometimes you lose your house.
Yes.
Come on, so that's another.
Sure, absolutely. It's a shame that if we get sick in this country, we could be facing a whole lot of other issues. And and then we haven't even talked about, which you hinted at a little bit, even if you have employer-sponsored insurance, but you get so sick you can no longer work, do you keep that employer-sponsored health insurance? No. You lose your job, you lose your coverage. And if you are so devastatingly sick that you can't work, and you need that health insurance because you're devastatingly sick, what do you do?
Oprah, I don't quote Oprah very often, but on her show where she interviewed Michael Moore, she put it very well. As a society, do we in fact believe that the son of a gas station attendant is equal for healthcare, has the same right to healthcare as the son of McGuire, the CEO of United Healthcare? Do we really fundamentally believe that those two people have the equal right to good health? I mean, the United Nations believes it. It's part of the Constitution of the United Nations. But do we as a people truly believe that? And if we do, what are we going to do about it?
Well, and unfortunately, the people who side generally on the side of, you know what, I've worked my whole life, I've earned this, let people go to work, let them figure it out for themselves, will change their tune in an instant if they face a devastating situation.
If people don't understand how quick one of the things we say in Expand is there's three kinds of people in this country. There's the uninsured, there's the underinsured, and there's the rest of us, and we're just unsure.
That's true.
Because whatever we've got right now, we can lose it tomorrow.
I want a very quick
Remember
question.
Frank Pominelli speaking at the meeting a few weeks ago about the loss he did and the cancer? And the only reason they said to him, you were going to come like that, was he had spent $2,000 on this cancer treatment, which, $4 million kind of money, but it's keeping it up. The average one knows.
Very quick question. Under this plan, it says the funding, the very last item is funds from government sources. How much would that be? And that is particularly critical these days when the state of Ohio is facing a budget shortfall.
Essentially, what that is, I touched on before a little bit, was what we'd like to do, and we can't do it until it's enacted, is go to the federal government when this is enacted and say, give us the Medicare money, give us the Medicaid money, the veterans money, and go away.
We're not talking about extra
No,
state money.
no. The way we came up with this funding plan, the first thing we do was we looked to see how much money is being spent in Ohio. And then, after we found out how much was being spent, and then, we saw how much was being spent by the government, and we saw we had to raise $36 billion, the taxes that we have here will raise that. So we're not looking at getting any more money. And then with the, again, with the $36 billion, and you take out the 30% of that that's currently going to administrative and profits for insurance companies, will be more than enough to cover all the uninsured in Ohio. And we actually expect to have an excess of funds. One of the things that you'll notice that we said in the thing is we use the term resident as opposed to citizens. We didn't set that because there's just so many ifs, ands, or buts. There are provisions in the bill for that to be determined. The bottom line is, if you go into a hospital, the first thing you do is you get treated. And later on, we can sort out, who's going to pay for it, how it's going to be paid for. So we recognize that, particularly in Southern Ohio, there's a large immigrant population that moves through there at harvest time and planting time and things like that. And these people need to be covered when they're in Ohio. We also recognize the fact that being an industrial state, at least somewhat, I may work in Pennsylvania and live in Ohio, or I may work in Indiana, and those people, or vice versa, work in Ohio or live in Indiana, and those people would also be covered. We want to make sure we were as inclusive as possible. And one of the things that people come up with, everybody's going to come to Ohio for health care. In reality, I don't see that happening. If that was true, everybody would have gone to Canada. Everybody didn't. The reality of it is, people aren't going to move. Businesses, I believe, will move when they see the cost savings. Because businesses aren't tiny, mom's not living there and things like that. Greg just gave me the thing, some of the resolutions that were, I guess these are all in Region 6.
I don't have
Some of in Region 6 is a multi-county area. Understand the state's broken up into 7 regions. And you guys are in Region 6, which includes, I'll tell you in a second, which counties that includes: Ashland, Carroll, Columbia, Holmes, Mahoney, Medina, Portage, Richmond, Stark, Summit, Trumbull, Tuscarawas, and Wayne counties. And these cities have passed resolutions in support of the act. One of the things I wanted to do a while ago was pass to a constitutional amendment and just say that the constitutional amendment would read something to the effect of: no elected official of the state or any of their subdivisions would be eligible to receive with tax dollars insurance that is superior to that of the least of their constituents. And basically put it all on the politicians to come up with something before they lost their health care. Kind of like Strickland says he's not taking health care until everybody's covered. We'd like to mandate that for everybody. Yeah. Strickland never has. It goes back a lot of years.
Are there any large businesses that, because when it comes down to it, and you do have pushback from insurance companies that go down to Columbus to lobby, are there any large employers who have agreed or that would be in support of SPAN?
It's interesting. Again, Rick Wagoner head of GM, has gone to the Canadian Parliament and talked about the Canadian healthcare plan and what other things that they need to include for his workers, and has come back across the border in the United States and said he will never support a universal single-payer healthcare plan. What I believe is it's the business roundtable. Kind of like we're all in this together. If we give it up right now for the insurance companies, then next year they're going to come after you, or they're going to come after you. So rather than breaking from the business roundtable, they're holding the line there.
What is it? Fear that if policy reflects that healthcare is more a need and a right and not a commodity this year, then maybe, good heavens, it might be education next year, or it might be housing the year after, or something else that is codified in the Universal Declaration of Human Rights. Or you can't have that. It's like water.
Oh, yeah. So, it makes more fiscal sense. It makes, it's the only way that we're going to get anywhere. And what I need for you all to do is to fill out a petition to get it back to me tomorrow. Or get it back to Mary tomorrow. She lives down there.